When you first start to notice a sign or a problem with the knee, it usually can start, well, in a variety of ways. Sometimes people have an accident or an injury and the knee just never gets better. Other times it can be a more gradual thing, just start with the ache and then it can get progressively worse and worse. But in general, when the symptoms last for more than several weeks is when you really should start to seek care and get a proper diagnosis and treatment. When you have arthritis in the knee, you should never rush to surgery. The first steps are always to attempt what we call conservative treatments. And the most basic things that I always recommend are exercise, strengthening the muscles around the joint, and if needed, certainly losing weight, because the knee sees around 4 times the weight of the body just with normal activity. So if you need to lose 25 pounds, it takes 100 pounds of pressure off the joint. Following that, the next thing that we do is we recommend either pain relievers or anti-inflammatory type drugs. And when those are not sufficient, we use injections. When all these things have failed, that's when people consider surgery. When the pain interferes with their quality of life, their ability to function, and they just can't take it anymore, and none of these other things that we have work, that's when we opt for surgery. We're always looking at the anatomy and what's wrong, and that's how we go about deciding what to fix. So if someone has a torn piece of meniscal cartilage, which is a disc inside of the knee, and the rest of the joint is healthy, that's someone who may benefit from an arthroscopic surgery. But once the joint goes bad, the meniscus actually becomes irrelevant and we're dealing more with the arthritis. And when that's the case, that's when we look at either partial or full knee replacement surgery. When we talk about knee replacements, there are some new developments. And one of the things that we started to do here at JFK is what's called personalized knee replacement. And that means that we're able to do a partial or a full knee replacement that's specifically made and geared for that patient. So one of the most common issues we encounter is patients really don't know when it's time to actually intervene and do surgery. And it's a hard decision, and it comes down to quality of life. And the set point is different for each person. On one hand, you don't want to jump to surgery because surgery is real and there's potential risk to surgery, so you don't want to jump right into it. But on the other hand, you don't want to wait too long. And a lot of people are so scared of surgery that they let their whole life slip away. And what the studies show is that the better shape you are going into surgery, the better shape you'll be coming out of it. So on one hand, you don't want to rush into surgery, but on the other hand, don't let it get so bad that it really does destroy your life.